day of surgery. The day of surgery has arrived. Now we'll go over the steps to follow before you head to your surgery location and what to expect.
On the day of your surgery, you will want to be sure to adhere to the following guidelines. After midnight, you may only drink water, Gatorade, black coffee, or plain tea up to 2 hours prior to your arrival. Once you are within 2 hours of your surgery time, do not eat or drink anything. Note, the use of cream in your coffee, tea, or consumption of any other food after midnight will result in either the delay or cancellation of your surgery. Take a full bath or shower, washing with the Hibiclens as instructed on the morning of your surgery. Do not wear any perfume, makeup, deodorant, lotion, baby powder, or jewelry to the facility. Note, if you are unable to remove your ring, please see a jeweler beforehand to assist you with removal. Do not have any finger or toenail polish on and no acrylic nails. Wear comfortable closed-toe shoes along with loose casual clothing that is easy to remove and put back on. This will make it easier for you after surgery. Open-toed shoes can be a fall hazard after surgery. Clothes that open in the front are generally easier for patients after shoulder surgery. If you wear eyeglasses, contact lenses, hearing aids, or dentures, bring these items along with their storage cases and any supplies you'll need. Please bring with you the orthopedic sling provided to you by your surgeon's office. As a precaution, you should bring any important legal forms, like a living will or a durable power of attorney. If you would like more information on preparing advanced directives, the pre-admission testing team can assist you. Remember to bring your photo identification, driver's license, insurance cards, and co-payment with you for registration. Any items brought with you should be given to your partner in care for safekeeping. Plan to arrive at the facility 2 hours before surgery. St. Elizabeth has multiple surgery site locations. Before leaving, you should verify the location and address of your surgery to ensure you are traveling to the correct location. Maps and address information can be found at www.stelizabeth.com. Regardless of where you have your surgery, you should enter via the main entrance. An associate at the entrance desk will be happy to provide guidance on where to go from there. What to expect after you arrive. Upon arrival, you will be taken to the same-day surgery preoperative area to prepare for surgery. As a safety measure, you will be asked to confirm your name and age multiple times. Once in same-day surgery, you will be provided a hospital gown, and your vitals on arrival will be taken. At this point, you will be provided with a surgery passport card. This card is a checklist and will provide you with insight regarding where you are in the surgery process. It is important to note that delays are possible. We will keep you updated every 30 minutes before your procedure. The anesthesiologist will visit you in same-day surgery and discuss the types of anesthesia which will be used during your surgery. If your surgeon has ordered a nerve block, you will receive the nerve block at this time. Your surgeon will also visit you in the same-day surgery. They will ask you to identify, usually with a marker, the site of your surgery. This too is a safety measure to ensure everyone is on the same page. This will be your last opportunity to ask the surgeon any lingering questions before your surgery. You will also be provided a medication to help you relax. The operating room. When it's time for your surgery, you will be moved to the operating room, or OR. The operating room may feel a bit cold. Please let us know if you are uncomfortable. We will be glad to give you a warm blanket. After anesthesia is administered, your surgical team will carefully position you to provide the best possible access to your shoulder joint. This positioning is done after you're asleep to minimize movement and ensure your comfort. Your surgeon will choose the prosthesis, or artificial shoulder joint, that best fits your anatomy and condition. The prosthesis is made up of a ball and a cup or socket. The ball replaces the head of your humerus, upper arm bone. The cup replaces the glenoid, shoulder socket. During surgery, your surgeon will remove the damaged bone and cartilage and place your new artificial shoulder joint. As part of this process, they will test the prosthesis by moving your arm through various motions to ensure the implant fits properly and allows for a good range of motion. This movement can lead to muscle soreness and pain after surgery. That's because, due to arthritis and stiffness, you likely haven't been using those muscles much. When muscles aren't used regularly, they weaken and tighten, a process called atrophy. So, when your surgeon moves your new shoulder during surgery, those underused muscles get a bit of a workout, and you'll definitely feel it afterward. But don't worry, your pain can be managed effectively with ice, elevation, and medication, all of which we strongly encourage to help you stay comfortable and recover well. While in the OR, you will be fitted with what we call A boots, short for athrombic boots. These are inflatable sleeves that gently squeeze your legs at regular intervals. That squeezing action mimics the natural movement of your muscles and helps push blood up through your legs. Just like walking would, these devices are helpful for the prevention of blood clots. Shoulder replacement surgery typically takes about 2 hours to complete. Once the procedure is finished, your surgeon will speak with your partner in care to provide an update on how everything went and answer any immediate questions.
After surgery. Now that we've covered the essentials for your surgery day, let's look at what to expect following your procedure.
After surgery, you will be moved to the Post-Anesthesia Care Unit, or PACU. Here we will monitor your vitals, help you manage your pain, and answer any questions. Other symptoms you may experience include dry mouth, nausea, itching, or chills. It's important that you notify your nurse if you have any of these symptoms. If your surgery is performed on an outpatient basis, when ready, you will be moved from the PACU back to same-day surgery to prepare for discharge. If you require an overnight stay in our facility, you'll be transported from PACU to our orthopedic unit for the remainder of your stay. It is important for patients to understand that they are considered a fall risk. After surgery, your operative arm will be placed in a sling to support healing and prevent unnecessary movement. If your surgeon uses a nerve block, your arm may also feel numb for several hours. Do not use your operative arm to assist with movement. This includes getting in or out of bed or standing up from a chair. Using the arm too soon can interfere with healing and increase your risk of injury. This, coupled with blood loss during surgery, anesthesia and pain medication can leave you feeling a bit dizzy or lightheaded. You could even pass out. For all of these reasons, it is in your best interest to call for assistance when you need to get in or out of bed or up and down from a chair. This goes for both patients who are discharged home as well as those who get admitted. You do not want to have to go back to surgery because you've fallen and damaged your new joint. Ask for help. Before you leave the facility, you'll be seen by a member of the physical therapy team. Their goal is to get you up and moving and assess your mobility needs to ensure you can navigate safely at home. They'll pay close attention to your balance and stability, especially when standing and walking. Depending on your condition and comfort level, they may recommend using a cane or a hemi-walker to support your recovery in the early days after surgery. You will also be shown how to go up and down steps and get in and out of the car. Your safety is our top priority. You won't be discharged until we're confident that you can move around safely and have the tools you need to support your healing at home. Discharge. Patients who have surgery at the hospital location are offered the use of our discharge medication delivery service. This service is available for patients who spend the night, as well as patients who go home the same day. This service allows us to fill any medication prescriptions your physician has ordered for you at discharge, your pain medication, anticoagulants, etc. This way, you will have these when you leave and will not need to make a stop at the pharmacy on the way home. If you are interested in participating, just let us know when you check in, and you will then be enrolled in the program. We'll prepare the medications and deliver them to you prior to discharge and collect your co-payment. This is a one-time thing. You are not required to use our pharmacy afterwards. Please plan for transportation home and avoid driving until your surgeon has cleared you to do so. Upon discharge, you will be wheeled to your vehicle. If possible, it is preferred that you leave in a mid-sized vehicle, simply because they are easier to get in and out of. If you have a low vehicle, some pillows on the seat might help. If you're particularly concerned regarding your ride home or anything around your house, please bring this up to physical therapy. This is their area of expertise, and they will be happy to provide insights.